Hi, and welcome again to Coach Talk. I'm here with another guest and another topic. This is going to be something quite interesting, hopefully, for our guests and viewers. It's something that maybe a little people might be a bit skeptical about. I myself did not understand the whole concept until I was actually studying and researching a little bit more about it. But I just want to firstly introduce my guest to you. Hi, how are you, Munir? Thank you so much for joining me.
Yeah, no problem. My pleasure. Thanks for the invitation.
No, you're welcome. I'm going to get back to you in a minute for you to describe because you do more than one thing. And I think it's really interesting because you are a dentist and a hypnotherapist. And I also realized that a lot of people have a fear of coming to the dentist, and it's actually quite something serious that a lot of dentists have taken on the hypnotherapy side of things in order to help their patients overcome this. And I find that
Mm,
interesting because when I studied NLP, which is neuro linguistic programming, I
mm,
also found that hypnotherapy was part of it, which I haven't really got into myself. But I sort of change habits and, help people with their subconscious mind,
mm.
in different techniques. But hypnotherapy is something that I'm really, really interested in. And the more I research and study, I'm actually more into it. But I'm sure you're going to give me all your details. So firstly, describe to me everything that you do, and we can hopefully get some guests, more interested, and we'll divulge into the actual questions once you've, sort of introduced yourself.
Yeah, so I'm a dentist by profession, but I suppose over the years working in the sort of medical field, you kind of get to see things that, and you want to maybe sometimes make a change in terms of what people call the alternative practices. So
Yes.
something like hypnotherapy may be called alternative. I'm also a beekeeper, so I'm quite interested in the medicinal properties of natural remedies.
A bee.
So yeah,
Okay.
so honey. I mean, as we know, in a lot of traditions, a lot of religions, honey is used as with with a sort of medicinal benefit to it.
Okay.
So I use a lot of that. I'm also starting to use propolis. So propolis is basically like a waxy resin that the bees produce, and it has a lot of amazing properties. The three to sort of mention are antifungal, antibacterial, antimicrobial, and I've been starting to use this in dentistry. So I've been learning from some sort of old hands in the game that are retiring now, and because of my sort of interest in the honey, I've been learning that. So you can use these things quite successfully in obviously my field with people who have, for example, just take an example, someone who's got a very nasty ulcer in the mouth. It can be quite painful, and what this propolis does from the beehive, as I say, it's like a waxy resin. It basically seals it, so the patient gets immediate relief of their pain. So that's just an example of something that I do. But in terms of the hypnotherapy side of things, so I got interested in this in terms of when I was treating. I treat a lot of nervous patients, and you speak to most patients, and no one likes going to the dentist anyway. Especially when
Yes.
some when especially, but if the problem is, especially if someone's in pain, a
Mm.
lot of times patients have left the problem for. We see patients sometimes after 30 years. That's how traumatized they are from either experiencing something from the dentist or just having an innate fear. So they've been conditioned. So sometimes, a lot of times, we'll see even a child who's never been to the dentist, and the parents will come in and say, "Oh, if you don't sit down, he's going to stick the needle in you," and that child's already scared. They've
Wow.
been so they've been conditioned from the parents,
Yeah. Yeah.
and sadly, obviously, if someone has faced a traumatic experience, that can again condition them to feel very negative. So I know we all know about the placebo effect.
Yes.
So something key to hypnotherapy, and we'll go into that, is something called the nocebo effect. I
Okay.
don't know if you've heard of that.
No, I haven't. I've heard of the placebo, but not the nocebo. So yeah,
Yeah.
you're
So just
going to enlighten me today, and I'm so interested. Already, you've raised so many questions in my head. Like I'm literally, pinging in my head right now because you mentioning about the fear, you mentioning about how we are conditioned, and the limiting beliefs, even from just one experience. That's everything that I work with. So.
mm,
I obviously train and help people in a different way with different techniques, but it's really interesting to know that hypnotherapy is also part of that. And the fact that
yeah.
you've actually even taken on to alternative medicines. I mean, in the actual medical industry, especially with dentists,
Mm.
is that allowed to be fact? Like, I really don't know what the rules and regulations are. Like, how does
Yeah,
it
yeah. I mean,
play in your way?
yeah. I mean, I think it's one of those things which is sort of regarded as alternative. So I think it's important and what I suppose one of my aims and goals is to get my colleagues in the field to start using these things more and more often, because they are natural, and patients are more coming to us for these natural remedies. Not everyone wants the medicines and the drugs, but I think the more of us that use it, and they're very safe, obviously following the main thing with using any bee product is you find out if the patient isn't allergic to pollen, bee stings, those kind of things. But there's very few side effects. So, we know that, and the literature shows us, and there's tons of literature about this. Even if you were to just, do a literature search on honey, the therapeutic effects of honey, there's so much out there that there's a lot of evidence. So I think us as practitioners, we need to sort of jump outside the box, because our conventional training is very based on surgery, drugs, medication. We don't know anything outside there. And, it's only until you as an individual start taking that, and it is a journey, it's a pathway, and it's like life is a never-ending book. You're constantly, each day we're learning something new. So one of my goals and aims is to not only assist my patients, but it's also to work with my colleagues and say, guys, there are some alternatives here that, are very useful and actually benefit the patient so much. Because especially, let's just take this example, the COVID situation, where the patients are unable to maybe get access to a dentist. If you've got a nasty ulcer, some of the things we can do are prescribe things, but they maybe can't come with a prescription. They can't go to the pharmacy. They could use something like propolis. It's so powerful, and they get immediate relief. That why are we not doing this?
I love doing this show because people like yourself are just so inspirational, and the fact that everyone I've chosen, like, you've surprised me with even what you've said about being a beekeeper and having this alternative medication, because I think that's really inspirational, and it shows how individuals are looking outside the box and giving alternatives, and especially with something that we're going through right now, so people can actually take things into their own hands, and they can actually do things for themselves more, which is what we are actually forced to do, to be honest. And if you as a professional that's giving that kind of learning and taking on the initiative yourself to do the research and do this, because just being a dentist alone is difficult enough, but then you also a hypnotherapist to help your patients overcome the fear of coming to the dentist, and as well as alternative medicine. Like, I don't think I'll find many dentists coming on in this way, so I'm really, really happy. So anyway, tell me a little bit more about hypnotherapy. I'm really, really interested to learn more about that, and from the beginning, how does it work? I mean, you sent me some notes, so you kind of like an idea. So what would the viewers firstly would like to sort of like, maybe want to hear and make themselves aware of when it comes to something like this?
Yeah, so I think a key thing when talking about clinical hypnotherapy is for everyone to understand that we're not doing stage hypnosis. It's a very key concept to understand, because what we see on TV, people are having a laugh, they're enjoying, someone's making someone dance like a chicken. That's because that individual is partaking in that. They want to do that. Now, the clinical hypnotherapist has no control of the patient. That's the key thing to understand. We're not putting you into some magical spell where you can't get out of it. Nothing like that. It's completely different. That's why it's safe and it's governed. So even people who practice clinical hypnotherapy are not allowed to do stage hypnosis, because they're two completely different ball games.
But when you practice this, but if you're practicing this in your actual, for example, your surgery, and it's just you and your patient, do you have like an assistant like you would normally if you were, doing a dental sort of practice, so people can be aware that if they are in a stage where they maybe feel like, if they not, like you said, a bit
vulnerable or something like that.
Exactly, feeling vulnerable. Do you have an assistant there?
100%. No dentist in the UK is allowed to practice this in the dental setting. And it's quite funny that when I did my training, so I did a medical diploma in clinical hypnotherapy, I was the only dentist in the group. The other 9 were psychiatrists. There was someone doing for a midwife doing for hypnobirths.
Okay.
But it's interesting, in conventional clinical hypnotherapy, you can just be the therapist and the patient in a room. Now that's something for me is very, very strange, because the guidelines that we follow, obviously the General Dental Council, the regulations that we follow, is no dentist is allowed to be with a patient, whether it's male or female, it's irrelevant. They cannot treat that patient or be alone with that patient. So that's a safety netting for my patients, that when I see them in a dental setting. But it's quite funny, when people kind of find out, friends find out, family find out. I get a lot of requests for doing this for non-dental things, and that's sort of taken me even further, because obviously makes me then have to research further, gain more knowledge,
In what example? non-further dental thing, what are you being asked to do?
So, for example, some parents have asked me to do it for their children who just can't sit still.
Really?
Revision, yeah. Also to help students study, memory. But also some patients, I'm saying patients, but some individuals have had life traumas, you know,
Yes.
and they've heard that hypnotherapy can assist them. Now, it's not that I've been able to say, oh yeah, sit down, I'll help you. I'm still on my learning journey. I'm using it mainly for my dental, but as I'm getting asked more and more for non-dental things. So, you know, as I say, it is a journey. And a lot of the times I have to say to the patient, well, you know, this is a bit out of my remit, yeah, but I can send you to someone with more knowledge in this very specialist field. So I'll give you an example. So I lecture at the university, and obviously, you know, I'm not going to name names, but one student has quite a troublesome, it's not a phobia, but whenever she hears people eating or grinding, it drives her absolutely crazy. And this is not a joke, because even in an exam room, if
I
someone's...
feel like that, but it's not, is that a phobia?
Well, it's actually a condition.
Okay.
So for her, it's very traumatic, because she can't go outside the house. You know, that's how traumatized she's from it. And she found out I was obviously doing it for the, you know, we do it in the dental school. I'm implementing it in there. And she approached me and I said, I'll be honest with you, I've never even heard of this condition, first of all. But I then did my own research. And because I kind of know, you know, obviously the field a little bit, I was able to then guide her. And now she's getting therapy by someone who's very specialized in this field.
Wow.
You know, so it's I think it's a chance for us as practitioners, again, to complement one another, support each other, and say, and put your hands up. I'm not an expert in everything. I don't know anything about that, but I can help you by guiding you to someone who can help you from it.
Yeah, no, absolutely. I mean, you are just fascinating me more and more you speak. So you're also a lecturer. I have to add that to the list. I don't know how I'm going to actually put all these things in the description box about what you do. No, but it's really interesting that you are someone who people can turn to, who is responsible. You are professional, and you'll be open about what you can and cannot do, and what you'd learn and what you can recommend, which is really highly beneficial, especially for somebody who is seeking hypnotherapy. Because like you said, most people just look at it as someone who has got control over you, and you know, it's quite scary. So it's good to sort of like lay this out and all the misconceptions. And I'm sure there are people that can manipulate, you know, others with this. So it is a dangerous field to get into to a certain extent. But like I said, someone like yourself who is trained, who is professional, who's got the, you know, sort of like the substance and the caliber behind it, the status, all of that, you know, I will definitely have all your details for people to reach out to, because I think in this moment in time as well, people are obviously looking within, and they do have you know, areas in life which they feel that more likely they want to maybe solve or fix or even tap into, which they probably wouldn't have done so before, or even things that have come up for them which never came up before, which has been you know, in their lifespan. So when we're talking about the actual process of hypnotherapy, could you like talk me through that a little bit more?
Yeah, sure. So what I actually like to do with a lot of patients is get away from using any of the terms hypnosis, hypnotherapy. What we're going to use is something that's very familiar to them, something that feels very comfortable, is deep guided relaxation.
Okay.
That's what we're doing. So what we're taking, so at the moment we're technically in the conscious mind. So there's 3 states of mind. The conscious mind, the subconscious is where we want to take our patients or clients. And then there's obviously the unconscious with something like general anesthesia.
Yeah.
So what we do as the therapist, we guide guide our clients or patients into a very deep, relaxed state. Now, in the subconscious mind is where all our memories are stored. So I'll give you an example. Someone has a life trauma. Okay. What it sets off is in the brain, the neural pathway. If we just think of it simply, think of a TomTom. Okay. And sometimes when you drive home, you've been going to work to the same destination for 20 years. You could almost close your eyes and drive home. Sometimes you even drive home and think, oh, how did I get here? You won't even think. That's exactly what hypnosis is. You're in this state that you're so deeply relaxed. It's like a bit like daydreaming. You know, you're sitting in front of the TV, you're watching TV, you're not asleep, but you're not awake. Someone comes in and says, oh, what happened? And you say, I'm not sure. Because you were in this transition phase between the conscious mind and the subconscious. And this is where we want to guide our patients to, because this state is where they become very suggestible. And this is therefore a point where you can give the relevant therapy. So obviously in my case, it's the dental. We'll be talking about aspects like that. But any clinical hypnotherapist, whether someone's phobic of a cat or a dog or whatever it is, they want to stop smoking, it's in this state of mind is where the patient is the most suggestible, and they can go deep into the memory. So you can do something called regression therapy, where say someone had a trauma at 5 years old, they may not remember, but that memory is stored in the brain, in the subconscious, they can't remember. So you can do a staged regression. So you're taking them back to that age. They relive that memory in the mind, but you reprocess it. So instead of the tom-tom now going to A, B, and C, because that's set in the brain, we're going to now take them to D, E, and F. And that new pathway is the positive pathway for that patient to be able to make that life change, if that kind of makes sense.
That is really interesting. I have been reading so much about this even before I actually spoke to you. And I myself, knowing a lot about the subconscious and the conscious mind, because, you know, NLP, neuro-linguistic programming is about, you know, taking a client to that stage, but without hypnotherapy, it's techniques and strategies. However, what people don't realize is the power within ourselves and the different frequencies that we have and the different stages in our daytime and nighttime, and the way in which we can actually, you know, when we talk about manifestation and affirmations and having this belief and trying to change our habits, it only does happen certain times. And when you were talking about when we're in that sleep mode, that's when even people, if they were to listen to certain messages to change their mode just before sleep, it can actually help them with their studies and learning and changing their habits, because that's when, am I correct, when it's at that theta mode frequency?
Yes,
alpha,
absolutely right.
the beta, and the theta, and that's when you either, you know, almost asleep, and that's when you go back to that stage, because when you're a child, all you're doing is mainly, you know, copying and following people. And it's in that subconscious state. And that's exactly what you're trying to do, is bring people back to that stage. So people don't understand when they're going to just general people without that extra knowledge, because even with myself, just being a life coach isn't enough. I had to do studies and research, into neuroscience and neuropsychology to understand this further about the brain capacity, and also learning and reading even psycho-cybernetics, which talks about the awareness and, you know, all of this hypnotherapy. So for me, it's like I listen to an audiobook every day. I have to do so much research. I bring in experts, but I have to do myself.
No, 100%. So
I think what I'm trying to say is, you know, individuals need to understand that they, you know, there is so much option out there, and I'm trying to raise awareness with the options. And someone like yourself is so vital to give this alternative kind of way of changing their states. Who can actually be hypnotized? Is there a limit? Is there a certain individual that can or cannot? Is it a will thing? Is it a person's characteristics, or what? Talk me through that, please.
No, it's a very important question. I think if you look at sort of what they talk about, the personality types, so someone who's type A personality, you know, very outgoing, you know, very flamboyant, maybe. Now, those patients or clients a lot of times will say, well, this is a joke, you know, you're never going to be able to do this to me. And 100% for definitely a certain percentage, if you look at the literature, they say about 10% of people are very hard to hypnotize. It's not that they can never be hypnotized, but very hard. But because these individuals, when they believe something, they believe in it 200%. So once you're able to get them into that deep, relaxed state and they experience it for themselves, those people switch from becoming the hardest people to becoming the easiest people. So imagine the change from that. So it's not that no one can ever be hypnotized, but it's a process. It takes time. So for example, even when I was learning, the first couple of times we did it, I just didn't understand it. I was still there. I was looking around the room. Everyone else seemed to be asleep and in trance. And I was just sitting there, I'm thinking, well, is there something wrong with me, or is this just a scam and everyone's just going along with it to please the lecturer? I didn't understand it. But when there was one session we did and I got so deeply relaxed and I I felt a positive change within me. I thought, this is phenomenal. You know, then I became then I became a believer, and sort of my passion for it went through. But it's interesting you talk about, I had a patient who was actually a counselor, quite well-known counselor, severe dental phobia. And just like you said, before she came to see me, I was actually very, very nervous because, you know, she's an expert in CBCT, she's an expert in NLP. And I was like, oh my God, I'm just a basic hypnotherapist on my journey. But what if she starts asking me these 1,000,001 mind questions? And it was interesting when I did the hypnotherapy on her, and it was just one session, and we actually did it over like this. It was over Skype.
Oh,
So she
right.
was at home. She wasn't able to come in. She was so nervous she couldn't even come to the dental surgery for an initial consultation. And she changed so much. She was like, I cannot believe this. I've always heard of hypnotherapy. I've been practicing for like 40 years. I've never, ever even referred one of my patients to it. And for me, it was a real eye-opener that someone in this mind, because it's, you know, it's a field, and I'm not saying hypnotherapy is right for everyone, and it's not.
No.
There's times when CBT is beautiful. There's times when NLP, you know, it's like we've got this box of tricks, and, you know, we got to, so even for myself, I need to assess and say, well, actually, you know what? Hypnotherapy is not right for you maybe at this time. You might need some initial work with X, Y, and Z, and then you can come back to me.
Well,
So I
actually,
keep talking about the process.
yeah, what you've raised for me, from what you just said, actually,
Mm.
whether it's hypnotherapy or any sort of like therapy or even
Mm.
coaching, which is not actually regarded as therapy, NLP is, but
Yeah,
it's all about the belief. So it's you being the
100%.
character to actually influence your patient or client with regards to eliminating that limiting belief. And that's what
Yep.
gets them, and that's why people can't change their habits, because they don't have that trust and belief. And when you are able to build that rapport over time and help them believe, and that's what I do with my clients, that automatically their situation hasn't changed, their circumstances haven't changed, but their mindset has changed, and that what changes everything.
So, you know, at the beginning I mentioned about the nocebo effect.
Yes,
So maybe if I just sort of,
go
so just
ahead.
to clarify for the view. So the placebo is whereby you could take a pink sugar tablet and you think it's a medication, you've got backache, and the backache miraculously goes away, but all you've taken is a sugar tablet. That's the mind working. That's called the placebo.
Yep.
But a lot of people, and I only got to know this through my sort of self-research in hypnotherapy, was the nocebo. So I'll give you an example, and it's like a live case study. So you're my patient. You come to see me as a dentist, and I'm about to give you the injection, which a lot of people are fearful for, okay? So I could say to you, well, you know, this is the already cool, soothing liquid. It's going to help to just make the area go nice and sleepy. And then I'm going to be able to treat you, and you're going to be absolutely fine afterwards. So that's one way me as a clinician can portray that to you. The other way I can do it is, well, I'm really, really sorry. I've got this really long needle. It's sharp. It's going to hurt. It doesn't taste nice, the liquid. You might feel sick. And I'm not sure if it's going to work. You've got so much infection. It might work. It might not work. Now, check this out. They did a study. So this is a clinical study done with not dental, but with something called a barium meal. So it's a meal. It's like a liquid that identifies problems in the gut.
Mm-hmm.
Exactly the same way. The first clinicians were told to give the happy spiel. The second ones were told to give a very negative one. And guess what correlation? So percent by percent, if there was 100 people in the study, the 50 that were told the negative thing, they never recovered from their problem. The 50 that were told that it was going to benefit them, they completely recovered.
Yes,
Now, is that not phenomenal?
that is phenomenal. And like I said before, as I was reading more about psychocybernetics, it talks about this, because at the end of the day, your nervous system does not know reality from truth. It's what you tell yourself.
Yes. This
And
is why when people
get
have these when they have these life traumas that are stuck in the memory, for me, the only real way to get them is through this clinical hypnotherapy.
yeah.
Because you're going into that subconscious where it's all stuck.
Your imagination is actually your current situation if you were to really believe.
That's so true. Very true. Very true. Very true.
Wow, this is fascinating. And it's so good that I've been studying all of this anyway before you even,
Yeah.
I've been manifesting you, I guess, just to come on my show and talk about it. So I didn't even think I'd have anyone. And, you've even surprised me right here, right now, because you only mentioned a couple of things that you do, but you do 10 more other things on top.
Oh, but I could talk for hours, but
No, of course, keep going. So obviously we've eradicated the common, misconceptions and things like that. Could you go through the actual clinical hypnosis work then, literally how it actually works when you're talking more, so that we can go through the actual process when, you're with a patient, and what's the actual process that you would actually perform?
So we break it up into several parts. So the first one is what we call hypnotic induction. So that's where we're getting the patient through. The ultimate means is to get eye closure. Okay, so we need eye closure in adults. It's very different in children. I don't do a lot of children, but in children, a child can have their eyes fully open and they can be in a complete hypnotic trance. Very different to an adult.
Wow.
So I know a lot of people would have seen in the classical, there's a French famous hypnotherapist, and it's called the Chevreul pendulum. Do you know what he uses the watch? Now, we don't do that, but it's basically what you're guiding that patient. So you can even get them to look at a spot on the wall. There's different techniques. So we use an induction technique. There's multiple ones. We don't need to go into the details. So we take them from their conscious state with the induction, and then we need to do what's called a deepener. So you may get them into that relaxed state, but you know, the mind's sort of all over the place at the moment because they're thinking about, oh, did I pick the kids up from school? Have I done, you know, the kids on the home? Whatever they're thinking of, the mind's still very, very active. So we get them in the induction. Then we do what's called a deepener. So the deepener now is taking them even deeper into their subconscious. Now, and we can do a couple of tests for this. So there's something called limb catalepsy. So I'll give you an example. I'll hold my hand here. So one of the things we can do as an example is when that patient is been inducted into the hypnotherapy, I can take hold of their hand, and it's called catalepsy. So I can make them imagine that their arm is completely limp. They can't move their arm, and they're going to allow me to have control of their hand. And this is also part of the consent process that we do before the procedure to, you know, hold someone's hand, etc. So I'll take their hand and I'll raise it up, and I've got to check now because they may be guiding me. If they're guiding me, it means they're very light, and I may need to do it. And this can be used as a deepen as well. And there'll come a point where I can literally either just leave the hand like that and it will stay limp, or I can say to you that the minute I let go of your hand and your hand drops down to your lap, you're going to go to an even deeper set. And it's phenomenal. You can say you're going to double your relaxation, you're going to triple your relaxation, you're going to go 10 times deeper.
But that's an indication for you as to how they're taking that hypnotherapy.
100%, because I need to kind of know where they are. Okay, so I've done the induction, I've done the deepener, and now I can go into the therapy. So whatever the therapy, obviously for me, it's a lot of time it's dental, more so non-dental, but whatever the therapy, if it's the fear of the cat or whatever, we do the relevant therapy.
So I guess the more cynical you are, the less likely. So it's more about you gaining that trust and getting that person to believe. That's what it's all about.
100%. And initially, it may take someone 2 or 3 sessions. Like I said to you, I took 5 sessions. I was a complete non-believer in it. I actually did the initial clinical hypnotherapy because I had a friend at university, and this is what actually struck me, and it struck me 20 years later. He read a book. He was a heavy smoker. And I said, this guy will never stop smoking. One day he came to university and he was not, and I said, what happened? Are you feeling right? He said, I read a book last night. I said, you read a book last night? He read Paul McKenna's book on how to stop smoking, and he stopped smoking the next day. And I was just shocked. But you know, you're going through uni, you're going through life. I forgot all about that. And then it dawned on me, you know, and I thought, well, it worked on that guy. I don't understand anything about it. There's so many patients that I see day in, day out, and dentists see day in, day out. They hate coming to see us. They're so scared of us. Well, let's do a bit of mind work on them. So I embarked on this course. It was forget dental school. This was like, this is it for me. It was phenomenal. You know, and I was learning with psychiatrists. So they were coming with stories, you know, of their patients obviously suffering quite severe medical issues, you know. And for them, you know, they'd come to the end of their drug regime. There was no more drugs they could give these guys. And they were like, we need something now. And it was just phenomenal to hear. I mean, their line of work is it's phenomenal, you know.
So when it comes to, okay, first you have that person to believe that, you know, they can be trusted to actually be hypnotized. So what is the work that actually goes into the actual session? Does that obviously come into consultation with that client as to what their goal is, and then you'll know how to direct them?
Yes. So obviously you'll do your initial.
Happen to anything and you don't know, and it's quite dangerous in that aspect, don't you think, to a certain extent?
No, definitely you have to have a consultation to understand what are your problems. Because especially as me as a dentist, if someone comes in and gives me this whole complex life trauma that I may not be able to handle, then that's where I hold my hands up and say, you know what, okay, you may need some other bits and pieces work done with someone who's doing CBT, NLP, whatever it is. Then come back to me and we can work on the dental stuff. It's not that I can just, so 100% we have to obviously do that consultation. Then draw that kind of program. Also, a common question when people say, well, how many sessions?
You don't
And
know.
it's very hard to say.
Mm,
You know, you can't say, well, I'm going to do it in 1, I'm going to do it in 5, I'm going to do it 10. It depends on you.
exactly.
But obviously over time, because there are clinical hypnotherapists that even advertise, you know, and they'll say, well, after 1 session, you'll stop smoking. And I find that phenomenal. But the reason they can say that is because they've had this 30 years of experience and they know what works now. And you have to be able to switch things around very carefully. So, very quickly. So for example, give an example. If I'm doing a deepener on a person, I can see, you know, it's just not working. I can't just then go on with the same script that I'm using. I've got to think outside the box. What does this person do? What's their profession? What's their life circumstance? What can they relate to that I can then utilize in my mind and my script to be able to take them into this deep, relaxed state for me then to be able to provide them with the therapy that they require to overcome whatever the problem is.
You just reminded me actually of the movie. I don't know if you watched Shallow Hal and Tony Robbins.
No.
You haven't. You have
Okay.
to watch that. Okay, so
I'm not a massive movie for, but yeah.
no, it's an old movie actually, and
Okay.
obviously you've heard of Tony Robbins,
Yeah.
Robbins, right? So he's obviously a life coach, hypnotherapist, and he was actually in the movie that tried
Right.
to convince this guy who was very much superficial about how he, viewed women, and he would only go after attractive women. But then he
Okay.
hypnotized him to make him go after just anybody, and he chose the one that obviously was the most, unattractive, and he fell in love with her. And that was the
Okay.
whole movie. But the thing is, he did
Yeah.
it within seconds, and he's done even programs within seconds where he can switch people. Now, what
Yes.
is that all about?
Okay. So when I talked about the induction, so you can do this, you know, if you think of a sort of a conventional clinical hypnotherapy session, it may take 45 minutes, an hour. You may be spending 15, 20 minutes getting that patient relaxed. Now, obviously in a clinical setting, whether it's at the doctor or the dentist, we need to use something called a rapid induction. So we need to do things quite successively in a short period of time, because I don't have an hour to sit with that patient before I can do the dentistry. And I need to get them in that relaxed state very, very quick. So that's called a rapid induction. Now, there's something further called the instant induction. Now, that I'm not an expert. I'm still fathoming in my mind how this works, and I'm trying to learn it. It's proving quite difficult for me. But there are hypnotherapists that, you probably see on YouTube where you see the picture and then they go and they sleep.
Yeah, exactly.
Now, so a lot of times that stuff is staged. That's what I say. Stage hypnosis is quite different, because usually in stage hypnosis, those patients are already in a state of hypnosis. You don't know.
Yes.
And what they're doing is, whether they're clicking the finger or saying sleep or whatever the trigger word they're using, it's just a trigger.
It's a trigger. No, you're right.
Yes.
You're absolutely right, because we use NLP techniques, which is about trigger, but then it's prepared from beforehand.
Yes, so that's
10 or 15 times, and then when it's done once, maybe on TV, then that's how it works. So I've just
okay. So that's called an instant induction.
Yeah.
Okay, and I don't do that. I do something which I can do in the clinical setting. It's called a rapid induction.
Okay.
So there was a famous American clinical hypnotherapist called Dave Ellman, and I'm sure there's others as well that do this, who did this. But he taught a lot of oral surgeons and dentists how to get the patient into a very relaxed state within 3 to 4 minutes, because you don't have hours to sit there.
Yeah.
It's a series of things that we do very rapidly that can take them into that deep state where we can then give them the therapy. So one thing that I do use the hypnotherapy for is sort of some of the work that I do, and in the hospital where I lecture on, is those patients who are just so scared to even go to the dentist. We have to give them medication through the veins.
Okay.
Sedatives. So they're not asleep. It's called conscious sedation. So they're still awake. They're just kind of, we say the brain has become a bit numb. They're a bit sleepy.
Relaxed. Yeah.
Yeah, relaxed. Now, I'll give you a case example. And this was an example that I did with one of the trainees there. There's a lady who came in with she suffered quite severe trauma from an ex-partner. Unfortunately, she deteriorated. Her mouth was, all her teeth were, in a bad state, and she really needed help. But before we started the sedation treatment, she would always relive that past experience. Why did you do this to me? It's unfair. So she became in a state. So whenever we even gave her the medicines, she wouldn't stop crying. She wouldn't stop talking. It becomes problematic. So what I did is, and this is just one session to show you the power of this, I did a rapid induction on her. So I got her into that relaxed state in a very, very short period of time. And then my suggestion to her was, you will not talk and you will not cry unless you're in pain. I have to be very careful with the words, because the last thing I want is a patient who's suffering pain when we're doing the treatment and not say anything.
Yeah,
Because obviously there's times we need to top up the local anesthesia. That's not a problem.
absolutely.
But you'd be, guess by what percentage we were able to reduce her drug dosage for? 50%. It's
I was about
phenomenal.
to say 50%, but
Yeah.
I wish I said it.
It's not a joke, because this not only is, it's so safe for the patient because we're reducing half the drugs we're using.
This is amazing stuff, and I don't think in England alone that we are much aware of this, or if it is, it's not really advertised or spoken about.
No,
Usually
no.
in the
I mean,
States,
places like, yeah, the
yeah,
Far East, Canada, even
States,
the work
yeah.
that I'm learning on, propolis and honey, just go globally, go Russia, go Romania, go Eastern Europe,
We
go
are way
China.
behind.
We are, and it's very sad because the way I feel the medical world is set up, it's set up against these things. I personally feel.
And it's not just the medical, it's also the mental, the
Yeah,
psychology
yeah.
as well, because
Well, I
it
sort of
does
add
have
that into the
that.
whole.
Yeah,
Yeah, yeah,
it's really
yeah,
about that. The more I get into this, the more I
yeah,
realize
yeah, yeah,
how much power we have within us if only we knew, and if only we
yeah.
took these alternatives. And again, it's us just being conditioned by our past experience, by our
Yep.
upbringing, by society. But
Yes,
we can
yes,
literally change in an instant if we really wanted, if we have these tools, and hypnotherapy is one of them. And this is why
exactly.
I feel so happy to have you on my show and to give this kind of information, because I think it's an alternative. Also, when you were saying about there's 2 points actually. One is about obviously what's happening right now, and what is the difference
Yeah,
in your practice with
yeah,
hypnotherapy, and what are the cases.
yeah,
And secondly, also, if you are sort of like seeing patients online,
yeah.
is there a danger because you're not close to them and near them, and if there were to maybe, I don't know, anything happen?
Yes, no. So don't get me wrong. I don't do a lot of online hypnotherapy. This was just this one case where I felt comfortable. This lady was a counselor. Husband was there, family was there. So I wasn't. But I generally don't. I generally don't do
But
that. It was just. Yeah,
it can be done, like even with Reiki and things like that. I know they do online because
yeah,
that's
yeah, yeah.
also working with energy. And
Yes.
personally, even just on a normal note, I don't like to do couples coaching unless they're physically in front of me, because if they start
Yes.
fighting online, I'm not
No.
there.
Yes. Yes.
So that's the
I
other
mean, I don't
thing.
do that. Yeah. Yeah. No,
'Cause
but I mean, yeah.
I
I generally
experienced
do it
that.
face to face. Yeah. Yeah. Yeah.
I experienced that. No, so yeah, there is
Oh
definitely
no.
something. I mean,
Yeah.
so what is the actual results from this pandemic with regards to the people coming to you with certain issues? Has it changed? What are the actual changes?
Yeah. I
What
mean.
are
I
the
mean.
actual issues?
So in my profession, obviously, just like with all
Oh yeah, the
whole
dentist.
society, whole community, but obviously, I'm talking about specifically what I'm dealing with. And I'm finding obviously a lot of dental practitioners and colleagues are quite distressed with this what's going on. So a lot of people are asking just for tips and techniques on what we call self hypnosis. So I didn't quite finish the whole therapy there. So
Sorry, yeah.
that's okay. So we got the patient, we did an induction, we did the deepener, then we gave the therapy. Now during this session, we also teach them self hypnosis. It's not just you go to the therapist one day and then So we give them little tips of how they can, again, if they're feeling distressed, whatever their problem was, they can sit down. Use an example. Imagine the ocean, the waves coming in and out. Close your eyes, hold your breath for 3 seconds while the ocean comes in. Just to, because a lot of people get panic attacks when they think of if they think of the dental problem or they think of the cat they're phobic of, they can get severe anxiety and, really have a panic attack. So it's giving those techniques, because what you want to do, and this, I don't know if you've heard of this term, but it's a term in neurophysics called neuroplasticity.
Yes, of course I have.
So, but I
I've
mean,
done neuroscience studies.
the reason I asked that is because it's nothing to do with my field, so it's very
Yeah,
new to me.
yeah.
So forgive me for that. But what I basically learned for myself is that your brain has created these channels, just like I said about the tom tom. You're going to work,
It's called
you know how to
synapses.
get,
Yes, it's called
but you
synapses.
can adapt it.
Yeah.
And that's what we're doing. But sometimes it's like muscle memory. If I keep doing that with my arm,
Yeah.
first day nothing, 1 week the muscles adapted, it's become stronger. So this sort of muscle memory in the brain, in the neurons, is what we want to get. But that the patient has to guide themselves over a period of time, so they get that neurological change by the neuroplasticity. Yeah.
Yes, no, I did study that recently myself. I did a couple of workshops on neuro, sort of like science on change. And
Mm.
confidence, and it did explain that, which is phenomenal, because it actually gives me more in-depth analysis as to how to treat my clients. And I know it's possible. And a lot of people say that you can't teach an old dog new tricks and all of that nonsense, but our brain has got the capability and the ability
phenomenal
beyond any capacity. So it's like, again, if only you believe. And also I bring the science behind it, not just the psychology, that my clients do have that ability of doing things. So yes, it's been, so yeah, with regards to finally, what's been happening now. So you're basically saying it's more about your colleagues finding the distress to actually deal with the kind of current situation. But then that, again, it's not necessarily a belief system. It's more about facing a fear of the unknown, right? So that's
that's very true, because obviously no one knows how long this is going to extend. Is it going to be one more week? Is it going to be one more month?
So what would be the therapy, the hypnotherapy for something like that, with the fear of the unknown? Would it be just to always be relaxed and just to always have hope? Like, what would be the answer to that? Or would it be the outcome specifically to what the client wants? Or would you suggest something?
Well, I think you sort of got to divide it into what's in their control and what's outside your control. So, the government's saying we have to stay in for another month. There's nothing I can do about that. There's nothing you can do about it. But it's embracing that and say, okay, well, I've got a month now.
What do I do with it?
Am I just going to sleep all day and get depressed about it? Or am I going to finish, I need to write a lecture. Can I finish that lecture? Can I take the kids for a walk? Whatever it is, but you've got to engage your mind into these positive actions, physical actions that will then improve your mental well-being, because it's out of your control. There's nothing you can do about it anyway.
No, I mean, I think you've raised a lot of issues that people will take away, knowing that they're in this state, but they can actually work towards something. And your brain, your mind, is really powerful. And even if we're feeling down, and like you said, there are people that have absolutely no idea what's happening. But again, it's your choice as to what you want to do. And we've come far enough in the weeks to sort of get over that excitement at the beginning, thinking that there's no work, there's nothing. And then after a while, you think, oh no, there might not ever be work. There may not ever be any. And then the fear starts to kick in, but then you can.
Yeah, it does.
And I'm not those kind of coaches to say, well, you need to be, motivated, skillful, and write a book in this time, because I understand that the trauma, and everyone's going to take it differently. The thing is, I really do think that we need to use our imagination more and build on that, and we can manifest, and we can actually create something from scratch, completely new, and rebuild and recreate. And it is possible, with help, of course, especially with someone like yourself, who is credible, who is responsible, and has the status behind, so that you can feel safe and comfortable to come to somebody like yourself. Are there any final thoughts before we end the conversation? I mean, I would love to go on, but obviously we have come to the end of the show. So are there any final sort of words that you'd like to say before the end?
Yeah, I mean, I think that there's a very famous sort of Arabic tradition saying that it says the disease, you, mean the patient, and I are three. Let me start again. I got that completely wrong. So the disease, you and I, meaning the clinician, the patient, are three. If we work as two will overcome one. So I think whether someone's having a physical disease or a mental health state disease, whatever that disease, if we truly as clinicians or healthcare workers, whatever you want to call us, work intrinsically with the most inner deep thoughts of that patient, not only to be able to give them, here's a drug, here's a tablet, but really work with the mind, then we can truly overcome. Because I showed through the clinical trials of this nocebo and the placebo, it shows you the mind is so powerful, and if we work together, we can overcome whatever the problem or disease is.
Thank you so much. It's been an absolute pleasure. Even I learned so much today myself. Alongside my research, you've even opened up my eyes to even more things. And I'm so grateful to have someone like you on the show. I think it's really, really vital, so useful. And it will give people another alternative to turn towards, which is what I want to do, is to bring people like yourself to share, your professional sort of like assistance in various ways. And you are more than one person in that one person's body. by what you
Too many
do.
hats.
Completely, yeah, and completely admire you. And again, thank you so much. I'm going to have all your details in the description box for anybody that's interested to contact Munir with his services. Please do so. I would highly recommend him, and hopefully you can get the assistance you need, knowing that you're going to be comfortable and someone who's trained and very responsible and will guide you if if he can do anything else, if he can't actually do something himself, which is what we need to hear right now, is for people to still give support regardless if they can do it for themselves. But he's got a network of people that can actually be guided towards your direction regardless. Thank you so much for this, Munir. I hope to speak to you soon. I'm sure I'm going to have you back again at some point. Thank you, the viewers, for watching, and I really appreciate your time for taking to subscribe and share, and please like, and if you haven't done so, please do so, and I will see you in the next episode. Thank you so much. Take care. Bye-bye.